Hello, and welcome to today's webinar. My name is Michelle Dixon, and I am the Program and Development Director for Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us today. Our topic today is the role of affected residents in discovering and acting on environmental contaminants, and I am very pleased to welcome to today's speaker, Dr. Phil Brown. Dr. Brown is University Distinguished Professor of Sociology and Health Sciences at Northeastern University, where he directs the Social Science Environmental Health Research Institute and its PFAS Project Lab, which has grants from National Science Foundation to study social policy and activism concerning PFAS, and from the National Institute of Environmental Health Sciences to study children's immune responses to PFAS and community response to contamination, and to develop a nationwide report back and information exchange. He is head of the Community Outreach and Translation Core of Northeastern University's Children's Environmental Health Center, and both the Research Translation Core and Community Engagement Core of Northeastern's Superfund Research Program. Dr. Brown, welcome.
Glad to be here today. So I'm going to talk about the role of affected residents, give you some examples of work that I've done and that some other folks, especially from Silent Spring Institute, that many of you will be familiar with, have done. And of course, I want to start by going back to Love Canal, which all of us remember in one way or another, because this is really what started the movement for affected residents to say something is going on here. There are health effects in our children. There are very visible signs of contamination. And this was obviously a super important phenomena, and it led to, among other things, the EPA Superfund program. And it also sparked a lot of other groups in other parts of the country to do similar things. Lois Gibbs, who is the hero there, and we'll talk about heroes later, wrote a book and then had the good fortune to do a 20th anniversary revision. And I heartily recommend these to anybody who was at all interested in seeing how did this come from, because today many of you listening are involved in some kind of environmental health advocacy or activism, but you don't always really go back to the source and say, where did this come from way back when? Now, one of the things that happened, I wasn't at all involved in environmental health at the time. I was doing a lot of other things, and nevertheless was reading and listening to the major things happening in the world of the environment, because it was such a big part of the social movements of the 60s and 70s that I had been raised in. And so a sociologist at Buffalo, Adeline Levine, wrote a book about Love Canal. And I read this book and I thought, this is amazing. These people have discovered this on their own, and they've recruited scientists to work with them. They've affected government policy. How did they do that? And I thought, you know, if anything, I would call this popular epidemiology. And the term popular had been used a lot for things in those days to affect, to mean that the people who were affected by things were coming to grips with them, and they were leading in that. So popular epidemiology really was about people taking the lead in doing epidemiological studies. And I had the good fortune some years later in the mid-'80s to begin looking at the Woburn case. And some of you may know about this because, you know, if you're listening from Massachusetts, this was a very important thing in our state's history. And for me, this became really the proof of concept for popular epidemiology. Among other things, it led to the reauthorization of the Superfund cleanup program in 1986. So this was a major contamination episode. People had discovered that there was a cancer cluster, and children's leukemia was very prevalent in areas near the contamination sites and the wells that people were getting their water from that were being affected by those contamination sites. So as I looked at this and had the ability to interview the parents of the kids and also the other activists, I began to think about this idea of popular epidemiology and what did I see in my background that would lead me to come up with this idea. So one of the themes that was very important to me was this idea of lay professional differences. I come from a background in medical sociology, and we were always talking about the differences between how lay people experience illness and how professionals diagnose it and treat it. We were also concerned with diagnostic biases. These typically were about giving diagnoses where they did not belong, such as calling women hysterical or having other kinds of diagnoses about mental illness, homosexuality is a form of mental illness. So a lot of sexist stereotypes and homophobic stereotypes that came out of the mental health field were very widely discussed among medical sociologists. This was the opposite case. This was people trying to get diagnoses where there weren't any officially coming forward, where the health professionals didn't really understand what environmental causation was about. And then, of course, there was a lot about social movements in health. There had been a very, very rich legacy from occupational health and safety struggles all the way through to the women's movement. And these were, women's health movement was a very, very powerful impact on a lot of people who were starting to think about environmental factors. Now, for me, I was a sociologist, and I was coming from that. I had not yet worked with environmental health scientists, so I was looking at what some other sociologists I knew were doing, and they were also talking about the role of affected residents in calling attention to the problems of environmental factors in disease. Kai Erickson wrote a wonderful book about a dam that broke from malfeasance of a corporation and in Appalachia, and it killed many people and destroyed a whole community. And he was the first person really to go in and do these ethnographic type studies of communities devastated by environmental disasters. Michael Edelstein, shortly thereafter, wrote a book called Contaminated Communities, and that title has given us a term that we now widely use, looking at water contamination in Legler, New Jersey. And then Steve Kroll-Smith and Steve Couch did a book on the underground mine fire in Centralia, Pennsylvania. And one of the things they discovered was that it's not always that easy to get a community to say, hey, we've got a problem, let's work on it. But they actually started to think about how there are divisions within communities that may impede the unified approach to seeking redress from government and or corporations. So when I put it together, I thought these were the stages of popular epidemiology. They really took many, many different levels and layers of action. Obviously, the first thing was that people start to see something that doesn't look right to them. Then they begin to hypothesize that there are connections, for instance, that maybe the water from the wells in Woburn is the problem. And then they create some common perspective. They get other people involved and they share a notion of what to do. And they ask government and they ask scientists to get research. They often don't get what they need. So they form then a community group to take this to a higher level. Then if they're lucky, they can get official studies conducted by experts and even bring in their own experts. Eventually, they often have to go to get litigation, and sometimes they even have to confront through demonstrations and other kinds of actions. And even when they have the evidence on their side, they still have to press for official corroboration. And in this case of Woburn, the Department of Public Health was very, very resistant to ever finding there was an environmental cause of the childhood leukemia and other diseases. Eventually, they did come around after reanalyzing the data, but again, it took a lot of community pressure. And despite that, continued vigilance is necessary because we can find many, many sites like Woburn where people did all the discovery, did all these steps, got promises for cleanup and remediation, and then it wasn't really forthcoming. So community groups often spend many decades working on an episode. I had the good fortune to write a book with my colleague Ed Mickelson. He was a psychiatrist who was at the time interviewing the families there to see what mental health effects there might have been from the exposure and from their children's illness and sometimes, unfortunately, their death. So we put together this book, No Safe Place, and it was one of the first that ever came out of this type. Now, there was also, of course, competition. And we talk about this in a friendly way in the social science world, but sometimes you get scooped like a journalist does. In this case, I didn't, but Jonathan Harr wrote a wonderful book, A Civil Action, and he started it before I started mine, but he didn't publish it until after. And he was very graceful, and he actually wrote a preface to the second edition of my book, the one that you saw with that green cover. Some of you are more likely to have known the film by John Travolta called A Civil Action. It took the exact same title from the book, And while it was a great book, focusing mainly on the legal aspect, not on the activism aspect, but really not a good film at all. To give us a little bit of a focus on comparing the competition, you might say, well, Jonathan Harr was fortunate. He got a review in the New York Times. Well, so did I. You might say that he did well. He was over 2 years on the New York Times paperback bestseller list. Me, I finally paid off a very small advance that was really token. If you look at the media, Disney Productions paid over $1 million for film rights. Now that seems like not so much these days, but it was then. It was a box office smash hit. And me, I was doing at the time black and white overhead transparencies. And finally, as we advanced scientifically, I got to PowerPoint. Acting, well, John Travolta played the lawyer, Jan Schlichtman, and I just continued to portray myself in the lecture hall. Theory, Jonathan Harr didn't have a theory. He was a journalist. He was telling a story. But I had this theory of popular epidemiology, and it really served me and many other researchers in the social sciences to do more studies of contaminated communities. And to give a plug for sociology and anthropology and science and technology studies, where a lot of this work was done, they really took very seriously the notion that you had to listen to communities and to see what they were doing. You had to explore them, in some cases even live there to see how they discovered and dealt with contamination. We were also very, very influenced at the time by environmental justice, which was growing. And even though the first People of Color Summit didn't happen until 1991, there had been a lot of activism about environmental justice even before that. And as we'll see, it was really quite contemporaneous with the first toxics activism. But these are photos of many groups that have done work of different types in different parts of the country on environmental justice. Most of us know from the mid-'80s about the Warren County protest about a landfill of PCBs. And this was a major, major event that started much of the movement. But what people don't realize often is that this was happening at the same time. And this movement eventually expanded a lot, and I think one of the great successes about the overall environmental movement is that you had pressure from the most severely affected people, residents of Black and Latino and Native American neighborhoods and areas, as well as people who lived in very poor places. And they put a lot of pressure on the mainstream environmental movement to do more of what they were doing. They wanted the communities to be active in regulatory decisions. They wanted activists even to have a say in how funds should be used by the federal government. They also were concerned that they didn't just want to be NIMBY. They didn't want the toxics taken out of their community and sent across the ocean to Africa, where many of them were. They wanted to also expand to transportation issues and land use and urban planning, eventually to things like food justice and climate justice most recently. So we saw how a movement could really expand the definition of what it meant to be affected. But what's really interesting is if we go back historically, way back to when the United Farm Workers was first telling us to boycott grapes in California, these early struggles by the agricultural workers talked about the DDT phenomena, and that's something which we would later see as quite connected with breast cancer. The impact that these workers had was very, very important, and it showed us the links between environment and labor rights and organizing and consumer education, and how to really build a national movement that many people, even if they weren't living in the areas, would still at least understand and support. One of the things that a lot of the environmental groups in affected communities would point to were heroes, and they would go back, of course, to Rachel Carson, who is, to many of us, the touchstone of all of this. Important to us here, as we listen to an NBCC broadcast, to understand the role of endocrine disruption in human health risks. And this was so much the start of the whole modern environmental movement. And then, of course, Lois Gibbs, who I've mentioned, the first to really organize a community around what we would come to call toxic trespass. So all of this interested me, and I began to think, well, now that I've studied Woburn, what else is next? How do we figure to tell the story of all these other communities around the country that are dealing with similar issues to Love Canal and to Woburn? So I got together a research program to look at the social discovery of disease and illness. And I also framed that in terms of the political issues and health policy issues surrounding it. And also, how could it change science? How could it get people involved in science? How could it convince scientists to take some alternative approaches? How could people in the world, many different worlds of science, understand the need to have safer production alternatives and ways to reduce toxicity, not just to deal with it after it was there? And of course, what were the ramifications? What could people do in terms of getting disease recognition, medical treatment, and prevention? So as I did this, I had a number of case studies. I was looking at some key things that were hot topics in the day. Asthma and air particulates were very important. And there I was going to look just at alternatives for community environment, a group here in Boston. I was going to look at Silent Spring Institute for breast cancer and environmental factors, and then for Gulf War illnesses, which were the most highly contentious, a center that the BU School of Public Health was doing at the local VA hospital. And then to figure out how to avoid all this in the first place, I was going to study the Toxics Use Reduction Institute, a wonderful state organization here, headquartered up at the University of Massachusetts Lowell, that had been doing great work in reducing toxics. The more I looked around, once I got the funding, I decided that there was a lot more going on, and I added groups. And I'll only talk today about the breast cancer part of it. But I began to see at the time that there were groups in the Bay Area and on Long Island and here in Massachusetts as well, that here we had a whole movement that I thought we could call the environmental breast cancer movement. And I remember talking to Barbara Brenner at Breast Cancer Action. I said, Barbara, would this be a good term for it? And she said, yeah, I like to call it the political breast cancer movement, but I think that works too. One of the things about these movements that I was studying is they were embodied, that it wasn't just something you signed a petition and joined, but that you or your loved ones or your neighbors, they experienced it, they felt it, it was in their bodies. And this was something very new to social movements. And it also included severe challenges to the existing medical and scientific paradigms. And importantly, and I've repeated this and I will continue to, it involved activists collaborating with scientists in pursuing prevention, treatment, research, and funding. And so as I thought about the environmental breast cancer movement, and now you're going to see familiar names, including yourselves, the MBCC folks here in the photos, Silent Spring Institute, of course, and in the Bay Area, Zero Breast Cancer, Breast Cancer Action, what was then the Breast Cancer Fund, now Breast Cancer Prevention Partners. And really the sense that there was a movement really all over the country of people who were doing something very different, trying to integrate environmental causation with the mainstream breast cancer movement. And they were combining tactics from the women's health movement and from the AIDS activists, who were some of the first to say, we want to sit at the table, we want to determine how NIH is going to pursue research. So these were hybrid movements, they were boundary movements, and they were composed not just of activists and social movement organizations, but they also had supporters outside. They had scientists, they had health voluntaries, they had academics, and sometimes government officials and legislators, and government agencies, or at least parts of those agencies, and foundations. And so we began to see a new kind of movement that wasn't something that you had to be a member of, but that was like much broader and bigger and was able to get a lot of new developments in this area. One of the things that was really important to many of us was biomonitoring, where the Centers for Disease Control played a very important role, and then California set up a similar biomonitoring program to them, but also a huge increase by academic researchers. And really importantly, and again, we get back to the role of lay people and organizations, what we call advocacy biomonitoring. And there's, I'll get to that later, but I want to mention here a couple of other things about these hybrid movements. I worked a lot on flame retardant issues as well. And here you see a list of, again, of many, many different players. So these hybrid movements were growing, and you had retailers and wholesalers and manufacturers and firefighters and hospital advocates and state and federal agencies. very, very important to see how many people would get involved in this. And so in the world of biomonitoring, we began to see a bit of a shift from the old icon of the 55-gallon drum to now the blood bag full of contaminated blood from different sources. And this became a new symbol that was widely used. And my ex-student, Becky Altman, talked about this a lot in her dissertation as symbolic persuasion, bleeding for the cause. And people all over the country were getting involved in this. And one particular thing about this was it could involve ordinary lay people in studies. One of the really highlight points of the origins of this was the Environmental Working Group in their study. And as you see here, they took the folks who were involved, a small sample size, but they agreed to go public. This was a very, very unique thing in the environmental health research world. And these 10 individuals were willing to put themselves on the public platform. And instead of the periodic table of the elements here, you have the periodic table of the furans and dioxins and PCBs and pesticides. And if you clicked on a viewer's photo, in this case, Andrea Martin, founder of the Breast Cancer Fund, you see their contamination. So this then led to an explosion of these kinds of studies. And I'm not going to go through these. People can later download these slides and look at them. But I just want to show you that not just in the US, but in Europe as well, many different organizations, whether it was the Environmental Working Group doing more, or the World Wildlife Fund, Commonweal, many other groups, an endless number of studies, in Greenpeace, local groups like the Northwest Toxics Coalition, and it just kept going. So many different groups like this. And again, the embodiment of it is these people were going public. They were putting themselves on the line to share their data with others because they knew that would be how to get people involved. And they talked in terms of chemical trespass. These were chemicals that nobody gave permission to come into our bodies, and the toxic ignorance of those who were doing it or not taking care of the results of it. And everybody realized that there were so many chemicals that were being used, but so few tested for health effects, and that our capacity to detect the chemicals was growing and growing. We didn't know how to interpret them. We also knew that there was a very short amount, a very small amount of regulatory benchmarks for comparison. So into this whole mix, Silent Spring begins the household exposure study on Cape Cod and tests household air and dust and urine samples from 120 homes. That was a subset of the larger breast cancer and environment study. And some of these were never tested before. And this was pretty groundbreaking. And they found so many of these chemicals in people's homes and bodies. Many pesticides, DDT in 2/3 of homes, phthalates were everywhere. Things that people weren't even talking about at the time were now getting attention. And the flame retardants, they pioneered the research on this. And so many of these chemicals just had no health-based guidelines at all. So this really led to a whole new set of studies. And this was a point in which I had the good fortune to start working with Silent Spring, and over the 15 years to do more and more projects together. We put together a project to study how the data was reported back to people on the Cape, and then to expand the study to Northern California, to Richmond, where many people were a fence-line community living right next to a gigantic refinery. And this was, interestingly, a grant that was funded by the NIEHS's EJ grants program that resulted from the EJ groups pushing NIEHS several years before and saying, if you want to study what's happening to our communities, you've got to have a grants program that's just not going only to scientists, but that's going to collaborations between community groups and scientists. And we were able to do this, Silent Spring obviously being a community group, and also adding our new partners, Communities for a Better Environment in California. And we studied these two neighborhoods, Liberty Village and Atchison Village, which, as you see, are right next to this huge refinery, as well as many other severe problems, whether they be from smaller to medium-sized metal plating companies or chemical companies, to rail yards and highways, and a large port as well. When we were starting, we were surprised to see a gigantic fire there in 2007. And it wasn't like the only one. In 2012, when we were hard at work on this, there was yet another huge explosion. And many, many people had to seek medical care for this. I'm not going to go into a lot of detail except to say that we did find a lot of contaminants and that they were extremely high. Many of them were higher indoors than outdoors, showing for the first time how a lot of chemicals that can only be produced outside are getting into people's homes, but also showing that in a comparison community of a very green, environmentally aware community of Bolinas in Marin County, north of this area, that people also had high levels of contaminants that came from household products and personal care products. And we learned from this that even though people could try very hard, they could not shop their way to safety. Now, we were fortunate to host in 2007 the Grantees conference. So dozens of the community groups and their academic partners from around the country who had these grants would meet every year, and we hosted the conference. And these are some photos from it, and you'll see some familiar faces on the right, Julie Brody and Ruth Ann Riddell from Silent Spring. One of the things I want to focus a little bit on is that there was a very groundbreaking thing here, which was the use of report back. And what I say groundbreaking because a few studies had done this, but it was a very rare thing. Mostly scientists came in, got their data, went back, did their analysis, reported this in journals, and the communities really knew nothing about it. But in this case, people started to say, well, when do I get my data back? And this launched a whole new idea of giving a report back. So that would include a lot of detail, both in text and graphs and narratives, and individual meetings with people to go over this, and community meetings to go over the aggregate data for how the whole community was affected. And we would do this in fairly simple language, and we would give people a lot of experience in looking at graphs. We would tell them first how to read what they're going to then see for their own results, and then to show them particular details. This is one example of pesticides in urine. And over the years, this got developed more and more into different approaches. Right now, Silent Spring and I are working together with the Superfund research program here. We study preterm birth in Puerto Rico and the effect of contaminants, especially phthalates and TCE, trichloroethylene. And we do the report back there as well. And we do this both, again, with individual meetings and community meetings. But it's another example also of how participants really drive this. And so when we began to talk to people about how they would like to get this data back, it wasn't just that they could use the digital exposure report back interface, Derby, that Silent Spring had developed for computer use. But the people in Puerto Rico said, we would prefer to get this on our smartphones. And Silent Spring said, okay, that makes sense, we'll do that. So they are very responsive to what the affected residents in Puerto Rico who were participants in this long-term cohort wanted. And these are just some of the examples of what that looks like on the smartphone. And people can scroll through it easy. It's a minimal level of words. People have lots of options to follow things up. They can click to learn more. Here's an example in Spanish. And there's some important things that we've found in this report back process. We call this the research right to know. So based on the right to know, which is about like what chemicals are in the factory next to me, or what's the toxics release inventory of toxic emissions for my county or zip code. What is it like now to be part of a research study and to have the right to get your knowledge? Well, we found that everybody wants to know the results, virtually everybody. And while they're concerned, they aren't psychologically injured by it. They don't have distress. And they take both personal action and collective action. They understand some of the key things that we hope they will, that a lot of chemicals are found, that substances like DDT that were banned are still around, that there are many, many sources for contaminants, things that we bring into our homes every day with or without knowing what's in them, and that these things are underregulated and understudied. And we also find along the way that people in these studies have a lot of trust in the researchers, and they take great pride in being part of science. For them, the pollution becomes personal. It is that embodied experience. It helps them reflect on past illnesses and current illnesses for them and their family. It gives them a sense of toxic trespass, and also motivates them to what we call research altruism, wanting to be part of these studies to help not just people in their direct family and neighborhood, but everybody who could be affected anywhere by the same chemicals. So the last thing I want to say is to give you another case study about what we call chemical class consciousness. What we mean here is consciousness of the whole chemical class of PFAS chemicals, the per and polyfluoroalkyl substances. Now, hopefully a lot of you on this webinar heard Laurel Shader present recently on PFAS, so I'm not going to repeat very much, but it was a great talk, and like this one, you can get it on the website, and I encourage you, if you're interested in PFAS, to listen to it. And this, too, is a story of lay people doing a lot of the work, and it's a story about the chemical contaminants that are present, or one of the most widely known stories going on in the world of environmental health. There's over almost 5,000 compounds that are involved here. We know very little about them. And it's a recent, very recently that this has come to public attention, but it is a remarkable experience to be part of this and to watch it unfold from a very, very low level of awareness. And it's a model of how, for me as a sociologist and other social scientists, can engage in environmental health scientists. And this is a picture of one of the really extremely knowledgeable and talented leaders, Andrea Miko, that we work a lot with from the group Testing for Peas in Portsmouth, New Hampshire. One of the things that we do know is from the C8 Health Panel that these diseases were found to be probable causes. And this was just from PFOA, one of the better known but now not used chemicals, but still around a lot. The only reason that we have this is because there was a class action suit. And when DuPont came to a settlement, they put a lot of money into an epidemiological study that was a very, very important thing to show with a sample size of 69,000, which we very, very rarely get. I mean, usually we get, hundreds of people if we're lucky in some of these studies, and often less. But with 69,000 people, we could say a lot. This was driven, again, by community awareness and activism. So this is just a little bit about some recent actions that have been taken at state levels to begin to regulate these chemicals, because EPA does not regulate them. They regulate them they give health advisories but do not regulate them. So New Jersey was the first. They only regulated one so far, and they're looking at two others. But if you go to the bottom, you see New Hampshire. These are very low. They've got the largest number of PFAS chemicals that have been regulated to date. So those numbers look really good. Those are quite low along the bottom. But let's go and look at what happened when the New Hampshire government said we're going to propose these regulatory levels. They were quite high, and their levels were just much, much higher than anybody expected, certainly since other states were doing it. But public pressure led them from January to July in just a half a year to reduce those regulatory binding levels very, very low. So this is, again, a sign of how yet another stage, a later stage in the process, state regulatory setting, that you can get important community involvement. But even at the beginning of this was driven by lay people. These farmers here, the tenants, were the ones who discovered the problem because all their cattle died when they sold a little bit of land to DuPont from the Parkersburg, West Virginia plant to dump waste that they were told would not be toxic. And their suit really is the thing that kicked it all off. Affected people, not just in localities, but around the country, have been pushing. Companies have taken these chemicals out of their products. States have started to ban PFAS in food packaging. And here, just in a 2-week period in September, last month in our state, the governor said he's going to put forth a lot of money to study and remediate PFAS. We saw the Pentagon showing 90 new Army installations were contaminated, and we saw the testing of some schools, and this really alarmed people a lot here on the front page of the Globe, that we had high PFAS in the water in many schools. One of the things that environmental activists have done, and they were really, really central, we collaborated with Silent Spring, with Northeastern, with many other folks to have a conference in 2017 here at Northeastern. And you see here Linda Birnbaum was the keynote speaker, and there were also important talks by Rob Bilott, who is the lawyer for that DuPont case, and Ken Cook from EWG. And over 2 days, this conference, really driven by the community activists, was a great accomplishment. We had 140 people. We had advocates from all over the country, and we also had everybody else who was involved in the situation, whether it was lawyers or journalists or filmmakers or health professionals or regulators. They were all there. But the agenda for this was driven by the activists. And the impact of this was that a national coalition was formed, a lot with the work of the Toxics Action Center and testing for Ps. And they've been really calling for increased attention to PFAS of all sorts, not just the long chain PFOA and PFAS that we have known about, but the shorter chain and the newer replacement chemicals. It was so successful that we decided that we had to have another one in 2019. And here we had even more people from not just around the US, but we had people traveling from Australia. We had people traveling from Europe to come. And we had to add a whole third day. And the nice thing here was that the Rhode Island, University of Rhode Island Superfund Research Program that Oral Shader is a part of, and she talked about in her presentation, helped to make this a great 3-day conference. And again, the activists drove the agenda. And here's some photos of some of them. The talks and the slideshows for these conferences you can find on our website, pfasproject.com. And Gina McCarthy, former head of the EPA, you see in the center, was also a speaker. And the last thing about PFAS is to mention REACH. Laurel Shader and I are the PIs of this, and we have a number of other colleagues. And this is a study that's just started a year ago, and we have other community partners as well, including, we're so happy, MBCC. And we're studying both on Cape Cod and in Portsmouth, New Hampshire, the effect of these contaminants on children's immune responses. And we know that there are reduced responses to the DTaP vaccine. That's a very important vaccine for children. And we'll be studying not only that, but we'll also be developing a website where anybody can come and use a tool there. If they have water data or if they have blood data, that they can plug that in and find out where they stand relative to the whole country's average, to the state average, if there is one, and to any kind of benchmarks there are from states. And as I say, we do have this decreased vaccine response, and the National Toxicology Program does think that these chemicals should be presumed to be an immune hazard. So we will, as I say, study the child's blood levels of these chemicals, develop that resource center, and then we'll also look at how people respond to this research. What do they do with it? Again, will we use the Derby report back tool? And here's one example of what it looks like from a recent example in the Child Health and Development Study in California, reporting back PFOS. The PFAS Exchange will be a web platform, not just to give the context for people's individual exposures, but to help community groups connect across the country. And we will do a lot of ethnographic study of how people respond to the contamination, what they've done, who they ask for help from, and how do they navigate this whole complex process. Again, like the other hybrid movements, this has what we call a multi-sector alliance. We've got not just the affected communities, but the scientists, both in academia and in regulatory bodies. We have scientists who are also working like advocates. We have active military and veterans, because so many of the PFAS sites are on military bases. We have water utilities and state officials, and we have federal funders and people along the supply chain, lawyers and journalists, all taking part in this multi-sector alliance. Very, very quick, things are happening faster than we can tell. We should be very happy to read this book, Exposure, by Rob Bilott, who talks about 20 years of fighting DuPont and bringing this to the public light. And since I started by talking about films, I'll end with films. Rob Bilott has now turned into a movie star, except he doesn't play himself. Mark Ruffalo plays him, and Anne Hathaway plays his wife. And this will be out in theaters November 22nd. And to close, PFAS is not exempt from pinkwashing, and we are fortunate at the end of Breast Cancer Industry Awareness Week. But 3M, one of the major causes of PFAS contamination, had the nerve to make pink Post-its and say, this breast cancer awareness cube shows your support to an important cause. And of course, our friends at Breast Cancer Action have a good response, as they always do. And they have a wonderful podcast with Sharon Lerner, who is a remarkable journalist who's been telling the story for very many years. And I encourage you all to listen to that. So thank you. I hope these connections make sense to you. And remember always the mural in Church Street in Harvard Square. Rachel Carson was right. And the precautionary principle tells us that indication of harm, not proof of harm, is our call to action.
Dr. Brown, thank you. We have a couple of questions that have come in while you were speaking, so I'd like to share those with you.
Okay.
The first one asks, at Joint Base Cape Cod's SDWA CER-CLA cleanup, the ATSDR conducted an investigation of the high causes of increased breast cancer rates and the contaminated sources, airborne versus groundwater, from specific source areas. The recent addition of PFAS to contamination of drinking water has raised concerns about airborne sources of PFAS contamination and its possible effects on the public health. Is this new concern justified?
I think it is. I mean, I'm not an expert in this area, but I will tell you that some of the EPA scientists who spoke at our conference talked about the relatively new focus on air pollution, because for a long time we were looking primarily at contamination in the soil and in the water. And they began to say that we've got to begin looking at air emissions as well. So I do think that this is going to become a very important new area of research as we go on. And again, this is an area that's moving faster than we can possibly imagine. So we now see the effects of PFAS in dairy. We've seen situations where people are even having to slaughter cattle herds because of contamination. We're seeing a lot of PFAS in sludge that's used as fertilizer and winds up in our food sources, not just in dairy, but in other produce. So it's a very fast-moving area of science to see different ways that we're getting exposed.
And this next question is a direct follow-up to that. How, as a community, how do we get around industries that are not telling us what they use, that they often hide behind the excuse of a trade secret or proprietary information, and that, or it's just not regulated. So how are we to know what's more likely to be toxic?
So it is true that there's a lot of trade secrecy, and even people at EPA who were given petitions to allow a new chemical don't have access to all the components of that based on what's called confidential business information. And they have only a few hours sometimes to process the whole request, and they've been approving dozens of new PFAS chemicals even in the last year or so. So one of the things we need to do, of course, is to have a new administration and a new approach to EPA that cuts down on this, that doesn't so quickly allow people to claim confidential business information, that takes a much harder look at how chemicals get added and start to begin to think, how do chemicals get taken off? How do we use the revised Toxic Substances Control Act, the Frank Lautenberg Act, to change the way we're looking at this? One of the other things that people have done is to use the legal discovery process. So in the DuPont case, Rob Bilott was able to get enormous amounts of incriminating evidence and was able to add that to a huge EPA docket. And we obtained that ourselves. I don't know how easy it would be to get it from the EPA currently. We got it from before the last election. And it was multiple DVDs with hundreds of thousands of pages and memos and emails and everything. Very, very incriminating. And we've loaded that on a site called Toxic Docs, toxicdocs.org. And that is a group that comes out of Columbia University School of Public Health. The trial of 3M, that lawsuit also unearthed a lot of incriminating evidence too. So I think that people can learn a lot by getting discovery. And I think we can also ask state governments to require that companies producing these chemicals tell us what's in them, so that we don't have to go and kind of reverse engineer and try to find out what's in them.
And I have a couple of questions I'm going to combine because they're addressing the same general area, which is, how do we get more scientists and academics involved with community groups? What advice would you give to a community group who's trying to draw attention to their issue?
Well, one of the successes I mentioned from the EJ groups that were pushing for federal funding changes was that NIEHS, and at the time also NIOSH, National Institute of Occupational Safety and Health, had several grant programs that were giving out funding. And the grant program we have now for the PFAS REACH I showed before with the Cape Cod and Portsmouth studies, that's that kind of example where they have to be joint efforts of community groups and activists. And also the Agency for Toxic Substances and Disease Registry recently announced its grants for a multi-site study of the health effects of PFAS. And that includes Peas being one of the first. Silent Spring was a grantee under this new one. And the ATSDR grant also required that there be partnerships between communities and academics. So I think one of the things we need to do is to push for not just the continuity, but the expansion of research programs, both at the state and the federal level, that bring community groups in. We need to have rapid response teams funded by state and federal governments that can send people out very quickly to do water sampling and dust sampling and food sampling, and work with community groups and help them get the resources they need. And there's no grant mechanism yet for that, but my hope is that, you know, a renewed EPA and other renewed federal agencies might be able to do this. So the other thing to do, of course, is community groups can try and connect with some of the researchers that they see around the country doing this. We saw that at our two conferences, a lot of researchers connected with eminent scientists. For instance, our friends that we work with in Portsmouth testing for Peas connected with Chris Higgins, and we were able to get a small grant involving a person here at Northeastern, Loretta Fernandez, to do water sampling up at the Portsmouth system, because while there was water sampling on the base, and the Air Force was quite good about doing this, didn't really tell us what the Portsmouth municipal water system was doing. So that was a small grant from a local foundation, but nevertheless, it's an indication of how community groups can push for research even on a limited basis. So I think coming to conferences like ours, meeting people who in the world of science have done this and who have an inclination to work with the community groups can help them do it. And we see that around the country, that there are a lot of these connections.
Wonderful. Thank you. Take one more minute to see if we have any additional questions. Well, Dr. Brown, on behalf of Cheryl Osimo, NBCC's Executive Director, and our Board of Directors, I want to thank you for taking the time to speak with us today. And I want to thank you. And I want to thank all of our listeners for joining us. And for those who are interested and want to hear the recording and see the slides in more detail, the recording will be available on our website later this afternoon at www.mbcc.org. I thank you all again. Dr. Brown, have a good afternoon.
You too.